everyone. We are just getting into the start of the flu season. The CDC has major concerns for pregnant women. The agency shared new data that shows 2 in 3 pregnant women are not getting the flu shot or the whooping cough vaccine. This morning, Dr. Emily Scott brings us this conversation. She's a pediatrician and the director of newborns at Riley. We're glad to have you here.
Thanks.
Big question to start off. Why aren't pregnant women getting these vaccines?
I just feel like sometimes moms don't realize the importance of it and how much it can impact both their health, but also the health of their newborn baby.
Now, some folks are concerned about vaccines, whether they're pregnant or not, because they think it'll make them sick.
Exactly.
What's your response to that?
You know, the flu vaccine and the Tdap vaccine, which are the 2 we really recommend during pregnancy, have a long track record of being very, very safe in pregnant women. So I tell them just to trust the evidence. It's totally good and safe to get.
Now, what about those who swear they've gotten sick? Oh, I got a shot, and then, the next day, I swear I had a cold or a cough or a sniffle. Is there any connection to that at all?
There really isn't. I mean, we know that you can get some local pain from vaccines. That's absolutely expected, but people do not catch the flu from getting their flu shot.
So then what are some of the risks that some of these pregnant women may be taking by not getting vaccinated?
Yeah. So, it's really, I look at it from both their health perspective and the health perspective of their baby. So if moms get the flu during their pregnancy, they are much more likely to get very seriously sick and are more likely to get hospitalized with the flu. So it's important for their health. But then when moms get flu vaccine and the Tdap vaccine during their pregnancy, they actually pass protection onto their baby for the first several months of their baby's life. And so their babies are really vulnerable, their immune system is just starting to kick in, but they can give their babies months of protection by getting those shots during their pregnancy.
Does this make a difference when during the pregnancy they decide to run into the pharmacy and get that shot?
That's a great question. So for the flu shot, they can get it in any trimester of pregnancy, so really any time. It's totally safe to get. With the Tdap shot, we recommend moms get that between 27 weeks and 36 weeks of their pregnancy because we know that is when it's most effective in protecting their baby. And the Tdap shot is the one that protects against whooping cough.
And tell me a little about that then, whooping cough. Obviously, I think that's more than just here in Indiana.
Yes, it's all over the country, and it's a very serious infection that newborn babies can get. It actually causes about 20 deaths in the United States a year in perfectly otherwise healthy babies. And most of those babies are under 3 months of age. You can't get vaccinated against it until you're 2 months. So moms getting that shot during their pregnancy is the only way we can keep these kids protected for those first couple months of life.
And would they get that from an adult who has it but is maybe fighting it off and isn't even aware that they're sick?
Exactly. So if an adult gets the whooping cough, it really just seems like a really long-lasting nagging cough that they can't get rid of. And so they might not realize they have something serious, but if they're around a newborn, they can pass it very, very easily.
So what about somebody who's saying, okay, I'm on the fence about this. What's your last, make sure you get these vaccines. What's your last message?
As a pediatrician, we see babies unfortunately come into Riley Hospital with both flu and whooping cough, and it can be deadly. And so this is a really, really safe and easy way that you can protect your baby.
And here we are, a week into October, 2 weeks now. This is the time to do it, hey?
Absolutely. We like it to get it done before the end of October.
All right, Dr. Scott, thanks so much for coming in and sharing that.
Of course.
We appreciate it. It's now 9:26. Drew?
Yeah, good information. The pace